This video is an introduction to the mid-frequency ventilation simulator. I know if you look over the left-hand side, it says mid-frequency. There's no R. I believe this is due to when I saved it as a Google document and messed with the spelling. But this simulator was created at the Cleveland Clinic by Robert Chatburn. And it's a nice tool, not only for mid-frequency ventilation, but it is based on all the models for pressure control ventilation. So not only can I use this simulator to see how mid-frequency ventilation will work, find my optimal frequency for optimal alveolar ventilation, but based on the rules of pressure control, I can look at the limits for tidal volume, limits for minute ventilation, mean alveolar pressure, and auto PEEP. With these same equations that are in the simulator, I can also use them to determine latency time and how many breaths to equilibrium if I'm using adaptive pressure control ventilation. So I'll be using this simulator to kind of go over concepts in my new courses. One's pressure control, and then also adaptive pressure control. Additionally, another thing I can do is I'm just going to go down here and scroll down. I can change this duty cycle here. So the duty cycle is the same thing as an inspiratory time or IE ratio. And I can change this to actually see what is the best setting for T-low and APRV or bi-level based on lung protective measures. So to see about tidal volume and how much auto PEEP it creates. So one example, based on this mathematical model, let's see, based on my pressure control setting, I have an inspiratory pressure 20. And I just want you to follow my arrow here. As you can see, 20, I've set it 20. And based on this compliance, we can go down here and you can see my max tidal volume attainable under these reference calculations. So this is one of the reference calculations for pressure control. The max tidal volume 600. And I'm going to go ahead and drop that compliance to 20. So I changed it to 20. And my max tidal volume attainable is 400 cc's. The only way that I can get a more tidal volume is to increase my inspiratory pressure. What we're looking at is input. I can put in patient variables as the patient's lung mechanics like compliance and resistance. I can put in the amount of dead space the patient has. And I can change the ventilatory variables, and then I'll get these output based on the mathematical models of pressure control. With that comes these nice graphs, which gives me my optimal frequency for alveolar minute ventilation. So this is just a short introduction to this nice tool. However, I'll be going over it more in some upcoming courses. Like I said before, a pressure control course, adaptive pressure control course, and of course a mid-frequency ventilation course. Thank you.